Shall I start now?
Yeah, you can start now.
Good morning, everyone. I have a presentation about comparison of efficacy and safety between Febuxostat and Allopurinol in early post-renal transplant recipients with new onset of hyperuricemia. Hyperuricemia is a metabolic disorder that causes the level of serum uric acid to exceed the upper limit of normal reference level. Hyperuricemia is one of the common complications in renal transplant recipients with an incidence rate from 25.1% at 3 months to 44.2% and 5 years after transplantation. Studies have suggested a positive association between hyperuricemia and progression of disease in individuals with renal insufficiency, including CKD and unrecovered allograft kidney. Elevated serum uric acid is associated with abnormal endothelial function, mitochondrial dysfunction, and glomerular arteriolopathy, and also could result in the formation of urate crystal in the nephron collecting ducts with tubular obstruction, and then cause the damage of kidney structure progressively. Febuxostat and allopurinol have both shown to be efficacious in hyperuricemia and gout and are well tolerated. For patients with CKD, many studies have been reported the beneficial effects of febuxostat and allopurinol on renal function. Uh, a randomized control trial demonstrated that allopurinol reduced the rate of decline in GFR in patients with CKD with eGFR less than 60, um, and febuxostat show a renoprotective effect and retarded the progression of kidney disease in patients compared with allopurinol. However, the impact of these two drugs on allograft renal function is conflicting. Retrospective analysis 20 of 54 renal transplant recipients using allopurinol demonstrate that allopurinol use was associated with preservation of eGFR in renal transplant recipients. Other studies found no apparent effect on eGFR for febuxostat. We are going to methodology. The inclusion criteria include serum uric acid level should be more than or equal to 420 micromole per liter for male. Just 1 minute. And postmenopausal. Serum uric acid level more than 360 micromole per liter for non-menopausal women. Receiving febuxostat or allopurinol for lowering serum uric acid level. The exclusion criteria that include age less than 18 years or more than 70 years. Gout or hyperuricemia before receiving renal transplantation. Discontinue treatment of immunosuppressive agent because of medical reason. Death. Use allopurinol or febuxostat before receiving renal transplantation to prevent the occurrence of hyperuricemia. Discontinue serum uric acid lowering agent or treatment of hyperuricemia for patients was changed from febuxostat to allopurinol or benzbromarol, or changed from allopurinol to febuxostat or benzbromarol during the follow-up period. There was 6 month follow-up after beginning the treatment of hyperuricemia. Patients in the Febuxostat group were given 40 mg OD of Febuxostat tablet, and the frequency was adjusted according to the serum uric acid level. Patients in allopurinol group were given allopurinol tablet 50 to 100 mg per dosage or sustained release capsule. According to this chart, we have two groups of patients. One group that received febuxostat and 63 patients receiving allopurinol with this inclusion criteria. And then it decreases the patient to 51 patients receiving febuxostat and then 38 patients receiving allopurinol. Results. The mean serum uric acid level of febuxostat and allopurinol groups were 572.23 plus minus 1, 17.80 micromole per liter and 587.06 plus minus 1, 06.11 micromole per liter before the treatment. There was a decrease in uric acid level in febuxostat and allopurinol groups after initiation of treatment, whereas the uric acid levels were significantly lower in febuxostat group than in allopurinol group on day 3, 7, and 15 and month 1. The most apparent difference was found on day 7 with uric acid level 267.25 plus minus 93.66 micromole per liter for febuxostat group and 34.18 plus minus 96.56 micromole per liter for allopurinol group. The significant differences between the two groups is appear on months 3 and 6. Similar results were found in serum uric acid decline proportion on day 7. The decline proportion were 52.92% in the febuxostat group and 41.79% in the allopurinol group. We investigated the effect of two drugs on the percentage of patients achieving target serum uric acid level and observed that 62.50% and 30.30% of patients achieved target uric acid level in febuxostat and allopurinol group on day 3 respectively. And the proportions were 93.75% and 75.76% on day 7. However, no significant differences were observed from day 15. The median times to achieve target uric acid level was 3 days and 5 days in the febuxostat group and allopurinol group respectively. According to this table, we have both of this febuxostat group and allopurinol group. We have different serum uric acid during the 6 months follow-up, and we can see the febuxostat is both of these two drugs. It decreases the serum uric acid, but the febuxostat is decreased faster than allopurinol. According to this, we can see the compare allopurinol and febuxostat. Febuxostat may cause a slightly quicker serum uric acid lowering effect at the beginning of treatment, but the advantages appear relatively with the extension of treatment. Safety. The common adverse drug reactions related to febuxostat and allopurinol include abnormalities of hematologic and hepatic function. Laboratory data including WBC, platelet hemoglobin, ALT and AST were analyzed throughout the study, and no abnormalities related to the two drugs were observed. Meanwhile, none of the patients in both groups experienced other adverse reactions related to febuxostat or allopurinol. Few study conclusion. Few studies have been reported on the effect of febuxostat and allopurinol in renal transplant recipients with hyperuricemia. A retrospective case control study performed in renal transplant recipients suggested that allopurinol reduced serum uric acid level and is associated with preservation of EGFR. Besides, uric acid lowering effect of febuxostat in renal transplant patients were also investigated. As compared to the reported studies, we compared the efficacy and safety of febuxostat and allopurinol. In conclusion, febuxostat caused a slightly quicker serum uric acid lowering effect than allopurinol at the beginning of treatment in early post-renal transplant recipients. There was no significant difference between the two drugs in impacting the renal allograft function recovery. Both drugs were well tolerated, but long-term safety needs to be further assessed. We are going to discussion. Febuxostat was demonstrated to cause a slightly quicker serum uric acid lowering effect than allopurinol at the beginning of treatment. No significant difference were found between these two drugs in promoting the renal allograft function recovery. The therapy for hyperuricemia with febuxostat and allopurinol in post-renal transplant recipients were both well tolerated, and no severe adverse effects were observed. Serum uric acid level and decline proportion between febuxostat and allopurinol groups showed significant variances on day 3, 7, and 15 and month 1, but this appeared on months 3 and 6 in their study. A similar result was observed in another retrospective study. A stable renal transplant recipients with hyperuricemia prescribed febuxostat, allopurinol, and benzbromarone had no significant difference in serum uric acid level on the months 1, 3, 6, and 12. Median time to achieve target serum uric acid level was shorter in febuxostat group than in allopurinol group in renal transplant recipients. A recent retrospective study also indicated that febuxostat led to faster achievement of target serum uric acid level than allopurinol in patients diagnosed with gout. As compared to gout, shorter time to reach target serum uric acid level was observed in post-renal transplant recipients with new onset of hyperuricemia. Because uric acid excretion disorder was caused by renal tool injury of renal allograft, and serum uric acid level may be easily controlled for functional recovery of renal allograft. Hyperuricemia has been known to negatively be correlated with EGFR and associated with the worsening of renal allograft function. Whether uric acid lowering therapy using febuxostat or allopurinol plays a role in promoting renal allograft function recovery is still unclear. Febuxostat and allopurinol show a renal protective effect and prevent the progression of renal disease in CKD patients. Febuxostat and allopurinol may have a promotion effect on renal allograft function recovery in early post-renal transplant recipients, but this needs further research. Thank you.
Students?
Thank you. It's finished.
Okay. Um, Students, do you have any doubts? Or is there any more points to discuss?
Ma'am.
Okay. Sarah, it was good.
Thank you, ma'am.
Stop recording.
Okay, sure.